Our special coverage continues live from Vincetta Garage in Berkeley. A new state health order is allowing more customers inside restaurants and other businesses. The change due to declining COVID-19 cases and increasing vaccinations. Tonight, the state is reporting over 78,000 new doses administered for a total now over 2.5 million, but many still struggle to get an appointment. 7 investigator Ross Jones shows us why it's harder in some places than in others.
My wife alone, probably 350 calls or more.
For the last 2 months, Terry Atkins and his siblings have been working around the clock trying to find a vaccine for their 94-year-old mother, Fritzi, who lives alone in Plymouth.
Called all of her doctors. She's got about 4 or 5 different doctors. We were even going down into Ohio, trying to find places for her to go.
After months of trying and failing, finally, Fritzi got an appointment for next Wednesday through the Wayne County Health Department. But her struggle highlights just how difficult finding access to the vaccine is for many, even those at greatest risk.
It's been very difficult.
With light at the end of the tunnel for Fritzi, the state just announced it's expanding vaccine eligibility to those over 50. It follows an announcement from the city of Detroit expanding eligibility to those with disabilities, regardless of their age. But outside of Detroit, where expansion is much slower, some lawmakers are fuming.
When seniors are most at risk to COVID and are struggling to get the vaccine, the state of Michigan is failing them with their social engineering policies, not the likelihood of death.
Senator Jim Runstead of White Lake is fighting against use of the Social Vulnerability Index, a metric that takes into account things like race and socioeconomic status for doling out the vaccine. He and other Republicans recently tried to ban its use here in Michigan, but public health experts say that's dangerous.
Targeting the populations that have poor access to medical care makes really good sense as far as if our goal is to prevent hospitalizations and deaths.
We know that COVID discriminates, impacting Black and brown individuals at greater levels, and Dr. PETRI says we need to take that into account when prioritizing who gets the vaccine first.
The populations that have suffered the most are African American and Latinx, and those are the populations that have the worst access to medical care.
And while Detroit may have expanded eligibility, it's still trailing its suburban counterparts. As of March 2nd, only 11% of Detroiters have received at least one shot versus 20% in Oakland, 16.5% in Macomb, and 21% in Washtenaw County. It's due in part to how the vaccine was rolled out. In the early stages, most doses went to hospitals, but not anymore.
I think the hospitals and health systems were getting at least 70% of the allocation for several weeks. We're now getting probably less than 30%.
The change happened over concerns that those not affiliated with a hospital system were likely to fall through the cracks, and that's especially true in Detroit.
Detroit was just a little bit out of that loop there, so that's why we had to really boost our efforts to make sure access is available.
Detroit's Good Neighbor program allows those 55 and older from the suburbs to get the shot so long as they drive an eligible Detroit senior to the TCF Center. So far, it's helped vaccinate more than 5,000 suburbanites. We're in Detroit tonight. I'm Ross Jones, 7 Action News.
All right, Ross, thank you.